Hey guys, Patrick First here. I'm an equine veterinarian and an avid Polocrosse player for the last 4 or 5 years here. I own an equine veterinary practice on the Gulf Coast, First Equine Veterinary Services, with my wife, Dr. Brittany First, and then we also have an amazing associate vet, Dr. Bastiana, who also plays Polocrosse as well. So I wanted to talk to you guys a little bit today about preparing your horse, especially during warm weather months for the tournaments. So here, especially in the Southeast, most of our tournaments are in the spring and the fall, and it's still quite hot out. A lot of times we're still competing whenever it's in the 80s, and it's quite humid. And that kind of weather can be pretty hard on an equine athlete if they're not prepared right, and if we're not monitoring, some vitals to make sure we're taking care of them. So I want to talk a little bit about some of the vitals for you guys to pay attention to, and then some of the issues that these horses can experience, in competition. So I'll just kind of start with, what vitals should you guys be aware of and be able to take, on your horses to know your horse is normal. That way, if you have an issue, something's different. So normal temp for a horse is going to be 99.5 to 101.5 Fahrenheit. You can check it with just a normal digital thermometer and just insert it into the rectum. Your normal pulse for a horse is going to be anywhere from 28 to 40 typically at rest. And the respiratory rate is going to be about 8 to 18 for a normal horse at rest. Now these will elevate dramatically, horses in intense work, at peak exercise, galloping, the heart rate can get over 200. So it's pretty remarkable that they can go from that, back down to such a low heart rate. It is important too, whenever we're looking at a horse's vitals, that we assess their, hydration and kind of their systemic status, their cardiovascular status. So we can look at their gums, make sure they're pink and moist. And then whenever we press on the gums and we blanch them, it should blanch back from white to pink in less than 2 seconds. If it's longer than 2 seconds, that can be a sign of some dehydration. We want to make sure our horses are drinking enough water. So typically we recommend for a horse, not in intense work, typically they'll drink on average about a 5-gallon bucket every 24 hours for a 1,000-pound horse. Horses, in the summertime when it's really hot can drink a whole lot more. So that can be, anywhere from 2 to 3 times that in a day. So we want to make sure we've got plenty of water available for those horses whenever they need it, especially coming off the field. So those are kind of our vitals. The big issues for us to consider whenever, we're competing and legging horses up in warm weather months. One factor we've got to consider is equine asthma. Quite a few horses, especially in the Southeast and in more humid conditions, asthma or an inflammatory airway disease can be an issue. Sometimes it's called HEAV, sometimes it's called COPD. It has a lot of names, but it's kind of an allergic airway issue. And so where the lower airways, they secrete a lot of mucus and the little bronchioles get pretty tight, and the horses become exercise intolerant. So a lot of mild cases are just a warm-up cough, and maybe the horse is just not at peak athletic performance. So that can be an issue. So that's something to be observant and aware of before the competition, to make sure your horse is, on the appropriate medications for that, and those allergens, whatever they be, whether it's a mold or a dust or a tree, those are managed. So equine asthma is one of the big ones that we worry about in the summer. Another one is going to be anhidrosis, so horses not sweating appropriately. And roughly a third of horses, especially along the Gulf Coast, will suffer from some degree of anhidrosis. So that doesn't mean they shut down completely, but with summers like we've had this summer that have been hot for 6-8 weeks in a stretch, we can see a whole population of horses just huffing and puffing. Their body temp gets elevated and they can't cool themselves down because they can't sweat. And so there's no way we can compete a horse like that. They just cannot thermoregulate and they'll become heat exhausted. So we've got to watch our horses sweating. And if it looks like they're not sweating, there's some things that we can do for those horses. One is going to be adding electrolytes to their food. Another can be making sure they don't have underlying endocrine issues like Cushing's. And then there's other adjunct therapies like some medications, acupuncture can help as well. So if we do have horses that are having sweating issues, we want to spot those, especially before a competition, and be aware that if our competition isn't a hot day, that, the sweating can shut down. The other issue too is going to be, horses becoming heat stressed or heat exhausted in very, very hot days. This is why it's really important to cool horses between chukkas, to either ice bath or, have a running water over them or a sponge bath, that kind of thing to keep them cool because their body temp can get quite high. In addition to that, we want to make sure they've got plenty of water after the match is done, whenever they return back there. So, there's a lot of concerns whenever horses are competing in that kind of weather. I think we can still do it safely. I think, it's our job to be an advocate for these guys. It's the sport of polocrosse is probably one of the more intense equestrian sports that are out there. I really didn't know it until I experienced it as a player. I love the sport. It's an addiction. I just love it. But in doing that, we've got to make sure that we're taking care of our horses to the best of our ability. So hopefully this was helpful. If you guys have any questions, feel free to reach out to me. You guys can Google First Equine and send us an email or a message. But thanks so much. Take care.